definitely a conversation though that also the design of the building, it being open on two ends, doesn't lend it to that. We'd have to rework them one.
So we're going to go into our final presentation of the day with Proactive MD, and here's yours. Tell us all about it.
Super excited. We actually serve Monroe County Schools. Our
Okay.
health center is right down the road. So we actually have 30 health centers here in, so we are Indiana. All of our management's here locally. So we're super excited to introduce Practice and talk to you all about how we're different. We were started 10 years ago with the purpose to change healthcare, to be more patient-centric, and to make sure that our patients are able to navigate healthcare, whether it be calls and or outside the. What you're going to hear a lot from the three today is that what we're doing today, how do we do it better tomorrow? And whether that's for the patient care, whether that's client innovation, and how can we better impact the healthier population, we're always striving to be. So super excited to dive in and appreciate the time. So again, we were founded 10 years ago, and all around the premise that the healthcare system is broken, and how can we serve site employers and improve the healthcare for your for your employees, for your spouse and dependents, and help guide them through healthcare chaos that exists today. Yeah. So we have 76 health centers around the country today. Majority of our health centers are municipalities, state governments, and school trusts and education. And we serve over 140,000 lives, 180. Okay. That's the salesperson. But honestly, one of the things that Jeremy and I have both been here for 6.5 years now. And one of the things continually see is the benefit of an Apex to partner with someone who is a true strategist for you all, that we call him the trusted advisor, and to work alongside you all to build something that's different, right? Again, it's not a build it and they'll come. We know that. We have to be proactive, no pun intended, at driving the engagement, at understanding the social determinants of health, at meeting each patient where they are. And that's what our focus is. So, Jeremy, I don't know, would you add?
We going to talk maybe a little education, but I mentioned that I come from the public sector. It's really cool what you guys do for the citizens of your county. And it's always great to be able to help
them healthy so they can help serve as well.
One of the things we found is each of our cities and counties and schools, as much as they're similar in the services they provide, their cultures are all a little. So one of the things we found is that we have to get in and really immerse ourselves into your culture to truly be able to understand how to engage, understand what some of the community resources that you might have are. We'll talk a little bit about environmental scans and truly understanding the Monroe area to be able to properly serve.
Moving on to the next slide. So just to dive in a little bit into what we're going to focus on today, you'll see the highlights here. However, there's a few that I wanted to highlight on top of that. So one thing that we really strive at Proactive MD to bring the ultimate experience to you guys is our service delivery. So not only the service to the patients, but the service to the clients. We'll dive a little bit deeper, but I'll hit on, our low client ratio to client relations manager, as well as just the overall experience that you guys would get from partnering with us versus maybe another vendor. Another thing too that we pride ourselves on is the broad scope primary care. So we're not just your urgent care type clinic that probably happened 10 plus years ago. We've really evolved with that, and I think we're one of the best at really providing that advanced primary care. So allowing our providers to practice at the top of their scope is one thing that we strive and encourage our providers to do. And then last but not least, and I'm going to hand it over to Jeremy because this is his forte, but we are extremely data focused. So not just pulling the numbers, like we've got a great team that can pull the numbers, but we actually know how to utilize those numbers to help grow that engagement, manage those chronic conditions and so forth.
Hey, I'm Jeremy. I lead our data, our technology, product and marketing teams at Proactive. This is the first time I've ever been in a presentation where I'm being transcribed live on a screen in front of me. So I'm going to try to keep myself present in the moment here and not get distracted. So it was great segue from Shelby. Data is at the heart of everything that we do at Proactive. I joined the company almost 7 years ago to help build out our data capabilities, because that was one of the things that we heard repeatedly in the space, is in order to drive a healthcare strategy and a benefit strategy, both from a client as well as from a benefits consultant perspective, you can't do that in an information vacuum. That's a new one as well.
Yeah, it'll just do two because it's 2 o'clock. So
glad we didn't do.
Yeah, you missed.
But ultimately being able to provide that information in a way that's actionable, that's meaningful. That's what we do at Proactive. We are a small but mighty team of data analysts, data engineers, and I would gush on them. They're wonderful. But some of the ways that we use this information is really, I think, what makes the difference. So in addition to being able to provide reporting to you all as the clients, we try to integrate all the information that we can get to really understand your population. So that includes not just the clinical data that we're collecting in electronic medical records, but also taking in the claims information. What's happening with your population? What's driving the cost? What's driving the acuity of chronic disease? And then how can we partner with you to be able to put those strategies in place that are going to be able to address those things? Have a healthier population, a more productive population for your team members, and ultimately help control healthcare costs that I'm sure, like most employers, you have experienced rising healthcare costs over the years. I see a big nod. Yeah, and so we put data at the center of that to be able to understand that. There are some things on this slide about how we use that information, understanding the risk of the population, providing it to our care team members, our patient advocates, our providers, to be able to do outreach to those patients. Not to say, hey, I hear you've got diabetes, why don't you come in for an appointment, but actually being able to just make sure that every one of your people knows that there is a healthcare home for them, that the services that we provide, hey, it's not just about acute urgent care, but we can take care of your other needs as well. And so that's helps us drive industry leading engagement. Another way that we use the information is understanding, as Christy said, your population. So we do what we call an environmental scan. We want to understand, even before we get in here, even beyond the claims information, what is unique about Monroe County? What is unique about the Bloomington area? We are all up and down Indiana, and we know every community is different. We work with one municipality. I'll give an example. In Colorado, actually, we did the environmental scan that revealed that suicide, self-harm was a leading cause of death, the leading cause of death, actually, in that county. Well, we're going to be treating first responders and police officers and firefighters and EMS that may be suffering themselves from the trauma from that job. So we made sure that that care team had specialized training in trauma-informed care, that we had gathered community resources to be able to connect people as we diagnose it, as we identify it, make sure that they're connected to the right resources as well. So it's very critical to us to understand you all as a population. Last thing I'll say about our approach to data here is we've been partnered with Apex for a number of years. We already share data, encounter level data, $0 claims with, used to be called Benefit Science Technology.
Same.
Okay, still same. So we provide that information. We don't charge for that. We don't want the health center to be a black box where take our word for it, stuff's happening. We've got a pie chart on the next page.
Yeah.
It really is about being able to share that information so that we're all coming to the table like this as partners to really drive the strategic decision making.
Of his at the onset of the slide, data is at the center. So whether it's our engagement strategy, whether it's our product strategy, whether it's empowering our providers, data is of how we make our decisions. And we found that to be really beneficial because we can take data back and say, gosh, there's a huge ER exposure here. Why is there an ER exposure? And their team will dive into it with us and say, here's the opportunity to pull those folks into primary care, reduce healthcare costs, but improve health and reduce angst too from the wait times, et cetera, that exist. So we identify problems and then we solve for them.
And then just on this slide quickly, we're proud of our reports. We have great standard reports that are delivered monthly, and then we do quarterly business reviews, comprehensive annual reporting. But we're also at your disposal. What questions would you have or metrics that would be valuable to see, whether it's once or whether it's every month? That's what we're here for. We don't charge for that. Our team actually loves the questions because typically when we're getting the questions from the client or from their consultant, those are the ones that are driving strategy. Those are the ones that are going to make the biggest impact. So we're at your disposal, the whole data team, to be able to figure out what can we do to answer that. Shelby, anything you would add about how you work through reports with?
One thing that I love, and this is just me not being a data analyst, but I love to be able to see the numbers. But one of my favorite things is with Jeremy's team. Sometimes I don't know exactly what we need, but we might kind of have an idea, right? And I'll be able to sit down and have a 15-minute conversation with them and say, this is what this client needs. This is what we think we need. They will take that and run with it and provide this most beautiful report. And I'm like, yes, that's why I have you. That's why I love you. And that's probably one of my favorite things with working with them is because they really can provide that. They can dive into so many different areas and usually even more than what I even expected to get. We also, as he mentioned, we do monthly, quarterly, annually reviewing reports, and being your client relations manager, we would sit down as frequently as you guys want and review those. We can dive in as deep as you want. It's probably one of the best things that we can provide to you guys, just because it allows the opportunity to find those gaps in care and find those opportunities of how can we engage in different ways and work as a partner with not just us, but with Apex too, to be able to really grow and, keep the health center going the way that it should be. Keep your people healthy and hopefully out of it, right? Like,
Yeah.
we want them to be healthy to where
Yeah,
they're
yeah.
not having to come see us 4 times a year. So that's all I had to add to that one. Moving on to the next one. This is just a quick highlight of, I believe this is a quarterly, correct? Yeah.
Do that for
Um,
emails.
Just a quick highlight of some of the numbers that we can provide for you guys. Again, we can dive into whatever is, whatever you guys want to see, but just as a quick overview, this is what you would typically get, along with about 20-ish other slides.
I was going to say,
Yeah.
this is the summary that at its now. Yeah.
Okay. moving away from data a little bit, wanted to focus a little bit more on the client relations side of things and the service that not only your patients would be getting, but as the client as well, you guys need good service too. We know that it's a partnership and it's not something where I'm just pushing you guys papers quarterly. We really want to make sure that we dive in with you guys and make sure that we're lockstep to ensure that the patients are getting the best care ultimately. So I would actually be your client relations manager, just as an FYI. I'm in Evansville, so a couple hours south from you guys, not too far. We would be lockstep during the implementations process. We have a dedicated implementations team that has done quite a few transitions. I think, would you say over 30? Over 30 in the last couple of years or so. So they can probably do it with their eyes closed by now. But knowing that you're going to have myself as well as a team to be able to support that transition, ultimately, we don't want the patients to feel it, right? That's the big thing. We know it's a pain for you guys to do any type of transition. We want to make it as smooth as possible for you, but also with those patients too. Being your client relations manager, we do operate a little bit differently than some of the other vendors. We have a low client to CRM ratio. So I have about 6 to 8 clients versus some of the other vendors I know have quite a bit more than that. So the benefit of that is we get to spend more time with you. And really make sure you're getting the care that you guys need to, and allowing that strategy opportunity, allowing you to come with concerns or ideas or opportunities and really be able to listen to you and then act on that as well. Our structure within the way that our care teams operate too is a little bit different. I know sometimes myself would also technically be managing the health center people. We actually have a clinic operations manager that I partner with. That keeps those clinicians, doing what they need to do because I'm not a clinician. So having that clinician report to a clinician, we have found has been very, very beneficial. It
Apples to apples.
it makes sense. I'm not going to talk to you about, a blood draw because I don't know what you're doing. I don't know how to manage that. So making sure that clinic operations manager is taking care of that team alongside with me taking care of the client. So we really work hand in hand. I talk to we have a lot of, what do you call those acronyms? I talk to my comms multiple times a day. We become very good friends just because, we're making sure that our clients and our patients are getting taken care of. As well as we would have another support if you guys choose to go the patient advocate route, and we'll dive into that too. That person also works hand in hand with myself and the comm to just make sure that operations are running smoothly, that engagement opportunities are happening, that people are coming in, for any of those chronic disease management situations and so forth. So we've got a little bit more of a robust team on the back end, but that's because we know that it works and it provides the most success. Trying to think if there's anything else that I need to hit on. We hit on the transitions. I hit on the structure of us. And then just all in all, again, because we have a low volume, we're able to give you guys more care and the service that you really deserve.
We realized early on when we were hiring the care team members from the local communities, whether it be health systems or local community providers, we were bringing them in assuming that they understood who they were serving, right? So in this case, they would serve Monroe County, and the difference in patient experience and customer service. And we thought they would just fold right in. And one of the things that with the CRM is very integral in is we take the report that Jeremy and Shelby talked about earlier, and we walk through that with Apex first, then we walk through it with the care team, and then the care team begins to understand the impact they're having. They can share the stories that are behind the numbers so that when we come present to you all, we're not just presenting numbers, we're stories and the impact that we're actually having, along with I really want to engage 100% of the diabetics. And here's my strategy to do that from a care team perspective. And the client relations manager, hand in hand with the care team, drive that strategy. And we saw a big impact because a light bulb came on with the providers in that, oh, I am only seeing 50% of the population. How do we impact more? Or I'm seeing 50% of the diabetics and here's their A1C. How do I impact more of the folks that we're seeing? And it just the numbers make it real for them.
And I think too, sharing those numbers with our care teams and really being open about how our business is, because we're not as a typical primary care facility, right? There's more parts to that. But I think the report is it's a motivator for them too, to be able to see oh, I lowered X amount of A1Cs this last quarter. I bet next quarter I can do even more than that. Or how can we help you reach that engagement number you're wanting to hit or so forth. So
Yeah, so if we're explaining our goals based on the data that we're seeing to the care team, they can focus on those things with certain populations and like that.
Exactly. And two, so whenever we're able to see, what's happening outside of our health center walls, we can integrate that into to reach those people that aren't seeing us, which is also awesome. Yeah. Okay. Moving on to diving in a little bit deeper, I mentioned broad scope primary care earlier in the presentation, but wanted to just, again, dive a little bit deeper into what that means. So essentially, we're allowing our providers to practice at the top of their scope. So if they feel comfortable doing something and have had the proper training and so forth, we allow that to happen in the health center. We're not going to send those referrals out because we know that that's where the costs come into play, right? Typical primary care facilities, you go in for your referral 9 times out of 10, it seems like, you have to go in, I know I have this mole I need to have taken off. I'm going to go get my referral so I can go to the dermatologist. As much as possible, we like to cut that out. Now, we're not saying that people don't need referrals out, right? Like we can still definitely handle that and take care of that when it's necessary. But if we have providers that are allowed to do what they need to do, we're going to save you guys money. We're going to save the patients money and time as well. So there, there's that little bit of convenience factor in there too. Our appointment times are longer than your typical primary care facility. So you're going to have an average of 30 to 45 minutes with your provider. We don't schedule based on the time slot. We schedule based on the patient needs. So if a patient has a lot of needs, we're going to make sure that we make time for them, which again is also different than your typical primary care, right? You guys aren't new to the clinic model, but go to your primary care, you're in there for about 7 minutes with the provider and then you're on your way. So allowing that time for our providers to dive in and really figure out what that patient needs and take care of those needs while they're there is one of the differentiators of us too. We typically have an average of 3 to 4 services per visit. So that means you're getting multiple services taken care of at a time rather than having to come back for other appointments. And then for chronic condition management, we've mentioned already, you guys know that's something we do love to do that we pride ourselves on and taking care of, but making sure that those patients are being seen as well. Ideally, we like to have them in 4 times a year. That they, if you're a diabetic, you need to have your A1C checked to make sure that medication you're on or the diet that you're working on is really being effective in what that care looks like. We, again, and Jeremy, you can tie back into this if you want, but we lean again heavily on the data to ensure that we're getting those patients taken care of for that too. And sharing that with the provider and sharing it with our patient advocate also, again, brings that full circle and that team in to make sure that those patients are getting the care that they need within our walls. Add to that one.
One of the things that we found is that when the provider build the relationships with the patients through, they don't tend to use the after hours for the, oh, I've got a sinus infection. They tend to use it for the more emergent needs, which is very important to build that trusting. So after hours is a part of the overall comprehensive fixed fee that we've quoted. In addition to hospital and home visits, providers are very willing to, and actually when they build a relationship with the patients, they want to be there for that. We had a situation recently with Town of Mount Pleasant in Charleston, South Carolina, where a police officer was in an accident of having to go to the ER. The care team actually identified the opportunity through a Facebook message. And the patient advocate went and met with the family at the hospital. Anyway, long story short, ended up taking them dinner. And Monday morning, the client walks by the patient advocate and says, hey, I meant to tell you the police officer was in an accident. She was like, I already know. Oh, we got you. And but that's what we do,
Yeah.
right? It's personal care. And we're really training and encouraging our care teams to dive in and immerse into your population.
And you were talking about those follow-up, like trying to get someone who would need to come in 4 times a year. Is your system set up to like trigger something so that you reach out and do that engagement to make sure they're coming in for those things?
Yeah, so we, again, going back to our patient advocate, and I know we haven't talked about that yet, you're probably napkin, but we'll get there. We actually have a dashboard that they work out of, and it's very user friendly. And again, utilizing that data that's coming to us and the data that's, within our walls already allows us to trigger, those patients, and make sure that they're getting that care that they need based on their risk.
We do a combination, of course, the automated, hey, it's time to come in for your visit, emails, text messages, but it's that warm touch that really helps people not just throw that message in the junk, but getting a text message from a human being, getting an email from a human being, means a lot. So being able to leverage that patient advocate dashboard alongside some of the technology and automations like that really helps provide that type.
In addition to primary care, we like to look at the services that you're seeking in the, what can we pull? Through the provider service, whether it be dermatological injections, how can we help you be even more efficient with the health center that you guys have today? So whether it be occupational health, pre-employment, physical, any type of fit for duty you guys may offer, anything that makes sense to have within the, going to look at the strategize with you to figure out how to improve.
Another thing too, that's not necessarily listed on this slide, but we do have a lot of partners as well. So if there's something that we can't provide within the four walls, we have opportunities to send that out at a reduced, therapy, imaging, therapy, primary care, surgery centers, that partners in the Indiana area as well. So you're not having to go to, California for that service, that we can share with you guys as well. Another thing too, that one of my favorite things whenever we do have such a great broker as Apex, but allowing them to share the benefits that you guys already have with us. So ensuring that our care teams are equipped with that information. That way, whenever they need to utilize a service, we can use what's already there. So, and I found that that's extremely beneficial to be able to have that partnership with your health. Allow those referrals out when need be to be something that's already integrated with you guys.
Hear that instead of utilizing.
If you make us, I'm.
And I'd like to write this check too.
Being tied back to a hospital system makes it a lot easier for us to say, yes, we can really, great with that.
Shelby's teased us out a couple times, and we'll all lean in on this slide because this is one of our favorite roles in our care team. From day one, the patient advocate has been paired with our provider. And one of the things that we found with our providers is that they embrace this role because it gives them the ability to spend time with the patient to understand what from a social determinant of health, what's going on in their family, and really treat the patient. And then the patient advocate is side by side, focused on the engagement. Like Shelby mentioned, they have a dashboard, and you set it up beautifully. How do we engage? We incent them to engage. It's not a build it and they'll come. It's who hasn't been here. So up front, our patient advocate, and actually this is Nicole Janeska. She serves Harlan Bakeries here in Indiana out of Avon. She's one of our best. And she and I actually spent 3 or 4 hours with Harlan Bakery's HR team, along with their consultant, just getting to know the culture. What were the benefits, like Shelby mentioned? What are the other things that you're offering to your population that we can help educate your population on, that the care team will benefit from understanding? And when they immerse themselves, then they learn where people meet. And they go out into the community and meet with your folks and engage them in a different way. So they're boots on the ground. So from an engagement perspective, they wake up every day and they look at that dashboard. Who can I engage from the high risk all the way to the low? They're also there to understand your benefit, that benefit concierge. They're there to identify community resources. Nicole serves a high Hispanic population that they need a medication assistance. And so she dives in with the family and helps them find ways to have whatever the services covered and or met. However, she can figure that out through different resources. They also help with referrals. So Shelby mentioned earlier, We try to limit our referrals. On average, it's between 7 and 8% right now, I believe. And when we do make those referrals, the patient advocate's the one that helps facilitate that. And we actually utilize a tool called Garner to identify high quality, low cost providers. But then we also lean on our care team. Our care team knows who the good providers are, who have the good bedside manner. So we take that as our baseline, but then we build a Monroe specific specialty network that we know have appointment availability, who will work with us. And the patient advocate pulls that patient back in. We don't want them to get sent to the specialist and get lost in the specialist world of different referrals. Do I understand how this medication works with that medication? We want to pull them back in and hold their hand through the entire process and help them. So that's a big role for them as well. One of the other benefits of the patient advocate, in a few of our health centers, they do counseling. So we hire a licensed clinical social worker. For one of our school districts in Pennsylvania, LIU, we had a situation recently where a child was flunking, and she was able to determine that he had OCD, and she was able to determine before he actually flunked out of the semester, he could unenroll, and they could get him on medication and then get him back into a thriving life. And so they get to know the patients, and again, whether it's patients, children, family members, and they meet them where they are.
Sorry, we
We
do
all-
all get
we all-
excited about it. One of the things they also work on is social determinants and the socioeconomic factors that patients and families are facing. All are public servants. I happen to know that probably not every one of you is driving around in a Rolls Royce. And there's a wide range of different occupations that are going to be part of your county. And people are going to be at different walks of life, different challenges that they have. And what we've learned is that in municipalities, patients, employees who are struggling financially don't always want to go straight to HR to talk about their struggles in case it's seen as, I'm angling for a raise, I'm concerned about this. So what happens is they deal with it in silence, and they deal with it without the support network that's there. Patient advocates are a way to connect them to those resources. It's somebody who's works on behalf of the patient, can work with the client, but can keep their confidence and help connect them, whether it's to food pantries, food assistance programs, housing assistance programs, financial literacy programs, some of those things that will help them get back on their feet. So they're coming into work not worried about where their next paycheck is, when their next paycheck comes, because they need a meal for their kids. They're coming into work ready to work on the job that you hired them for.
I think. So, again, they're going to be able to keep the privacy of the patient, but still be able to help with a lot of things that you guys would like to help with, but people are uncomfortable coming to you with. Another thing too is they're going to be a benefit specialist as well. So it takes a little bit of weight off of you too. You may have less questions coming to you and more coming to that patient advocate, which is always a beautiful thing when you're in HR, right? Like to have a little bit extra help. So just wanted to add that in as well.
Trademark Care Beyond the Walls, because we know that majority of your costs are in the community. And so we want to make sure that, as we talked about earlier, we know the right specialist to refer. We know that they have appointment available. One of the things that we're piloting right now with our clients is virtual specialty care, so that we can do a peer-to-peer at the time of visit with the patient to make sure that we reduce time and the referrals even necessary, right? Kind of like a second. Again, we're always looking at how do we do it better? How do we better serve population? So identifying the high quality, low cost, but then understanding bedside manner, understanding prescriptive habits, understanding surgical biases. Those are really costs. It can move quick and a patient can get lost. So we want to make sure that we've got the foundation built for our care team, the patient advocate proactively manage it for you all, and that again, we're there to hold the patient's hand through the actively manage.
You've heard us say it probably several times already, meet patients where they are. So we have a patient portal, DrMD portal, available on the iOS and Android app stores. It's fine. It's a portal, right? You do everything that a portal needs to do. You can schedule appointments online. You can message with your providers, request refills, see your medical records. All of them do that. It's just kind of the check the box thing. What's important for us is not relying exclusively on that as the way for our patients to be able to connect with. So depending on the population, you probably have microcultures even within your county government. Possibly you have folks who don't have smartphones, are still using flip phones and prepaid phones, and every minute of data is expensive and is something that they don't want to use to schedule an appointment. So making sure that they have the ways to schedule, whether it's through calling in, that they've got other means of access, that they know they can pop by the front desk on their lunch break and we'll work them in if we can, and if not, make sure that they've got an appointment as well, is very key to us. Not being locked into technology and a particular system is part of our model. Again, we want to be able to integrate with all the partners that we have, the partners that you have. But our EMR, we use one called Athena Health. It's fully interoperable with Epic. Every hospital in America either uses Epic or Cerner, and if they're on Epic, they're planning on switching to Cerner and vice versa. Athena connects with both of them. It's part of a health information exchange. So anytime medical records can be transferred in real time from those facilities, et cetera. So when we're sending somebody out in the community, we make sure that the provider we're sending them to, the specialist facility, has their medical records. And again, as they have tests, if they have imaging or going to that specialty appointment, those visit notes are flowing back to us as well, so that we're able to continue to be the quarterback of their care and alongside them every step of the way.
But I know it says after hour care. How would that work if somebody has something come up in the middle of the night? Do you guys have a triage line or what happens there?
That one. So they actually would call the health center and follow the prompt. They would leave a message for the provider and the provider would call them back. I believe it's within 30 minutes. Is that right?
Typically less than 15 minutes.
Okay, even
Yep.
better than what I thought. Less than 15 minutes, they'll get a call back. They do actually talk to one of our providers, which is a huge plus. It's not going to a third party. It stays within PMD. So they're going to have access to those medical records. And it is more of a triage line. If somebody has a medication question or needs to know, I've got a sore throat. Do you think I can make it overnight? Do you think I need to go to the ER? I mean, having chest pain, go to the ER, but it's more of a triage process. But yes, we do offer it 365 days a year.
What we found is that patients, if they know that they're going to talk to Dr. Jan, who's their doctor that they've known for a couple of years, they're not going to call her at 3 a.m. with a random my finger itches. What do you think about that? So those are the calls our providers want to get, and we've built our model around providers and care teams wanting to take those. But again, making sure that there's backup. Once in a while, they take a night off as well, or a weekend. So we make sure that there's always a PMD provider access to their chart and can get them connected to the care they need or scheduled for an appointment first thing in the morning.
Guys, any questions so far? We shared a lot of information.
So, I mean, any questions I might have had, I feel like we answered.
Gonna dive into the money part, so that's probably why she wanted to pause.
Yeah.
No, I'm kidding. Okay, so we actually base our model on what we call a comprehensive fixed fee. So with that, you will have 95% of your fees monthly wrapped up into this fixed fee portion. Labs and meds under 15 are included in that fee. All of the staffing, things like that are going to be included in that fee. The 5% of pass through those small amounts that may be over the 15 or any type of a new laptop or something along those lines that aren't going to be those regular frequent reoccurring expenses. One of the things that we found with that is that being that we do have the comprehensive fixed fee model, it makes it a lot easier for you guys to budget, right? So I don't know, from your billing model you guys have currently, but I'm sure you feel it with other vendors. You think you got it down and then all of a sudden next month comes and it's skyrocketed and then it drops back down. So having the fixed fee really allows you guys to budget. It also puts PMD at risk. So if there's cost increases or staffing changes or anything like that, we take on that risk and it's not pushed back on you guys.
Services, diving into the culture and really being your boots on the ground to immerse and drive engagement, but also just care, right? Personal care. That's all included. The client relations manager, which again, we're very intentional to be high touch with y'all because it's not a build it and they'll come. You're spending a lot of money and we need to be thinking, how do we do it better tomorrow? And that client relations manager, hand in hand with patient advocate who's do a lot of that. All the ad hoc reporting that Jerry mentioned earlier, there's not a nickel and diming, right? It's all in that comprehensive. And you know, one of the things that I don't know that we mentioned, which is probably one of our biggest differentiators, one of the ways that or one of the reasons that it allows us to be that flexible and nimble and intentional for y'all is we're privately held. So we have one founder with a few private investors, and so it allows us the ability to good and right and to do what we say. If you call our reference right, all of the things we talk about, it sounds really good. The work on the back end, the elbow grease, we put it in to make sure that you all are getting what we sold.
Okay, so we proposed you guys two different models, but wanted to just preface these slides by saying we are extremely open to hearing your suggestions on this and are happy to price out. We know you love your care team. So with these two models, it is a lesser amount of staff. So if that is something that you guys would really like to keep the whole care team, happy to do that. However, this was more so based on these are the amount of lives that you guys have. This is our recommendation for it being a dedicated site to you all. So not being a shared site, again, if you're open to continuing that shared model, we're happy to do so. But we felt like it might be best just to start back with you guys and then maybe build off of that.
Yeah, I think I appreciate that because our at this point, we're not sure what the most efficient use of the providers or the time or you know, the hours are. And so paring it down to like the base and then building off of that, I think is what we're looking to do. Just so that's good. Yeah.
It
So-
does. I think option one, the only scary part is, do you guys successfully have a clinic that only has 2 staff? Our one thing was, should we do 2 MAs versus just 1? Or do you feel like 2 staff is efficient for a clinic? That was our only worrisome thing on option one was, can we really operate a clinic with just 2 staff members?
Have clinics that do operate with just 2 staff members.
Okay.
I would say you have to have the right staff,
Yeah.
right? You know, that's super important. You guys do have existing staff that you love. If it were up to me, and you guys feel free to chime in too, if you are interested in keeping the MD model and are concerned about that, I wouldn't necessarily add on another MA. I would add on a patient advocate as that third party. that
Okay.
third person.
Can one thing we explore as because it's not priced out today, is operating 40 hours a week still,
Okay,
but doing an NP only model, so getting rid of the physician model.
okay.
And I'd be indifferent, but if you guys suggest, hey, we need an MA with that, or maybe we need an MA in the advocate that you suggest, I think that would be a very enticing option to look at just from a pricing standpoint. So NP led with maybe 2 additional support staff.
Actually, go to the next slide.
Yeah.
We have that priced out for you guys. So 40-hour
this is- there we
access, we have 1 NP, 1 MA, and then 1 40-hour patient advocate. So you'll see the first 2 years are a fixed price, and then the 3rd year, we do have a slight increase on that. Is that what you were looking for, Sarah? Yes.
Yeah, I think
Okay.
so, because the patient advocate is also more the social work kind of
Yes.
person
Yeah.
that we feel like is a good fit. Yep.
Yes.
So we do have to have that additional, so we would want to dive in with y'all and understand how they engage, how your folks engage with the health center to make sure we set it up right from the beginning. Because
Yeah,
our biggest.
It is the
that.
phone. We're trying to drive them to
Yes,
be,
keep saying that.
yeah,
That's
to
a good
use
point.
the app a little bit more.
Yeah, over 65% of their participants said they prefer using the phone. So we know, and that's what the 1-to-1 model scares me a little bit. And actually 5% say they like to just go in person. So we're talking 70% are more comfortable not going online. And knowing that demographic, I think it's really important we have the staff that can accommodate that.
Especially in transition, you want it to go, right? You want it to be even better than what you have today.
Yes.
We do make sure calls don't go unanswered too. So in the event that a MA or a nurse is rooming a patient and can't answer the phone at the front, it rolls over into a corporate service center where somebody answers. They can continue to schedule the appointment, leave a message for the provider or care team, whatever the patient needs. So it is important to us that things don't just go to a voicemail and nobody gets a call back, because that's a frustrating experience for patients as well as for the staff.
So model 2 would be our preferred model.
Okay.
Again, essentially because we have that patient advocate in place. We do feel like it's, if you can't tell, it's a really integral part on just making the difference in the population and having that extra support there. But if you guys sit back and, think about it and think, oh, we really want an MD on site, let's see how we can make it work. We're happy to price that out for you. We just wanted to still have some more conversations, even though I think I asked about the staffing model 7 times.
I think this is just fine.
Yes.
Okay.
Yeah.
Okay, perfect. Any questions on that?
Mm-mm.
Okay. I think this might be our last, yes, last slide.
So last thing on PGs, transparency is important. That's why we have the data, and we want to be held accountable. So for us to be able to say, hey, we're gonna engage your population, we want you to be able to hold us accountable to that. So we've kind of got a standard 4-part performance guarantee. We place up to 20% of our total service fees at risk. So not just a management fee or a smaller proportion. It's 20% of kind of the big bill around these 4 areas. The first is risk stratified engagement. What we mean there is we break your population a low, medium, high risk. If what we do is we say we're going to engage up to 80% of your population, your employees, and it's all the 26-year-olds who run marathons every weekend, we're probably not going to do a whole lot for moving the needle in the health of your population or your healthcare costs. So we would say, hey, we want to be able to engage up to 80% of your high risk, up to 80% of medium, and up to 80% of your low risk, so that those people who are high cost claimants or potential high cost claimants are connected in with primary care. That's important to us. And it's going to be shown in the results that you have as well. The second is clinical outcomes. People getting healthier. So we look at chronic disease. Are we able to move the needle, lower A1Cs, lower hypertension and heart disease? The third is service levels. Shelby, as you can tell, is just a terrible person, and we want to hear all about it. Now, if there's a failure, if we miss something, we want to know about it, and we want to be able to do right by you and make it right. And then the last one is return on investment. Ours is a little bit different than a lot of the industry because we are taking in claims information. We actually build our performance guarantee around being able to impact your total cost of care. So for us to say we're going to save you money and you're like, 13% medical increase last year, where exactly did it come from? Is probably not a good situation to be in. So for us, it's being able to project out, working with Apex, working with you all to project out, here's what your healthcare costs have been, here's where they're going, and setting targets, clear targets from a PMPM standpoint to keep your population's costs below that level. No, that was a lot. Any questions around our PGs or the financial piece, anything?
I'll close with, and Shelby add on. For 6 years, we've grown our business across the country. So we're based in South Carolina, a huge presence here in Indiana. It's been really fun to earn the right from the trusted advisor to the employer to do it different. And whether it's educating our care teams and leaning in on the data to understand how many calls are coming in, can we push them to virtual or to the app, or the patient advocate, and what's the difference of that patient advocate? Is it really making a difference? And each of our customers is different. Cultures are different. What you're trying to achieve is different than a chicken plant, is different than Town of Mount Pleasant, isn't it, right? And our client relations managers lean into that. And it's pretty cool to, I'm on texting basis with most of our clients, and they call or they text or they email, and this person did that, or the good stories, right? We're making a difference. And clinically we're sound, but what are we doing to drive change for y'all? but you've done a good job. You've built your foundation. How do we take it to a different level? And that's what we're really passionate about. About 75% of our new business are transitions. So, we're getting pretty good at it.
I've worked with them as they had acquired several years ago, a clinic vendor, and we
Yeah.
were skeptical on what that would look like. And you guys really stepped up and rose to the occasion and have maintained those clients then. So I have been impressed by the transition and have confidence that if you guys were selected, I feel like we'd have a very seamless transition. We've worked with Shelby enough, right? So we know what the data looks like. So that is a big piece too, that we're looking for the better data. I also do like the referral program that you spoke to, working with Garner. I know the importance of figuring out this quality and cost because that's what's going to drive our claims, right? That I see on the back end. So I think you covered a lot of my questions from the presentation. I don't know if you guys had anything else to add.
Appreciating the knowledge we've gained today in regards to the difference between independent options versus our network options. Been a very unique day.
Made it.
We did
You
it.
made it.
We might
did
have
it.
more
Yeah.
questions. You're probably going to hear from us again, but we just appreciate this time and
Yeah.
all this education.
Thank you.
Thank
We appreciate you guys.
Make sure your team gets the extra copies for Angie as well.
Yes.
And if you guys need any of that digitally, let me know. Happy to send that over to you.
Thank you so much.
Is that their one with the tax bill?
Yes, thanks, AJ.
Thanks for your help, by the way.
Yeah.
The unsung hero.